It's Erica and I study medicine, and I just wanted to tell you about the dangers of trying to optimize your health. So you might know about this guy. His name is Bryan Johnson. He's this super wealthy guy who wants to live forever, and he does a whole bunch of medical procedures and treatments and stuff like that in order to try and achieve that. So there's a huge issue then, though, in that he's pursuing a whole bunch of medical procedures that don't have something very important within medicine, and that's called indication. He is, by most definitions of the word, a healthy individual for which a lot of treatments would not really be indicated. However, because he is in the pursuit of trying to live forever, he does a whole lot of procedures. One of these things that really stood out to me is that he started doing testosterone treatments. This is something that is indicated for hypogonadism, but not for men who are within the normal range of testosterone. The reason that we need an indication is that illnesses make sense to treat when we know that the effect of the treatment will outweigh the side effects of it. When we don't look for indication and we just treat people without knowing if there is the proper indication for that, we risk just having the patient suffer from the side effects without really getting the benefit of the treatment. And this isn't just for medications or surgery, but it's also for screening methods as well. If you're not a patient who falls within this certain category of patient and you're getting tested for something, all you're really doing is increasing your chances of being a false positive. So for it to say that you have the illness without actually having the illness. And this can make it take so much longer for the doctors to find the true cause of your symptoms and then treat that accordingly. Like I said, he was doing these testosterone treatments, and this was with the intention of optimizing his health, of course, because that's everything that he does. However, then later he ended up stopping it. And why did he end up stopping it? Because the side effects got too great. So what he says is dramatic sperm health improvements are most likely from eliminating TRT. That brings us to one of the huge side effects of testosterone therapy, infertility. The thing is, though, a lot of men nowadays are trying to optimize their health. A lot of people in general are trying to optimize their health. And one of the ways that men are doing it is by taking this testosterone. It's not without side effects. It's not without issues. If you're not someone who's within that pathologically low range that indicates then this treatment, then you just increase your risk of side effects. So this is a huge thing, and yet we have so many people doing it and it being marketed to so many men. And testosterone treatments aren't the only thing. If we think about also weight loss drugs, people may look thinner, but if they aren't appropriately matched with the drug, then they can develop painful gastrointestinal side effects, they can have kidney damage, heart issues, can even have thyroid tumors. I think it's very important that people are aware that these treatments are not always going to optimize your health, and sometimes these treatments can make you sick too. So stay healthy, be careful, and follow me if you want to hear more about what I have to say.